notified directly either by the CDC or the state of the change.
Central Illinois health departments were caught off guard by the CDC's latest COVID-19 testing guidelines. Some say it directly contradicts the previous federal recommendations during this pandemic. Good evening, I'm Jessica Coons. The CDC is now saying that people exposed to coronavirus who don't have symptoms don't need to be tested. WCIA3's Jennifer Jensen is live in the newsroom. So Jennifer, why this sudden change?
Jessica, the CDC did not explain why they made that change. But one interesting thing to note is that key White House coronavirus task force member Dr. Anthony Fauci said he was not part of the decision-making process of this because he was in surgery during the guideline discussion. He says he's concerned about the interpretation of this recommendation and worried it will give people the incorrect assumption that asymptomatic spread is not a concern. Local health departments in Central Illinois share the same apprehension. Local public health officials are confronting unexpected news during the COVID-19 pandemic.
We were surprised to hear that there was even a new recommendation.
The CDC's new recommendation says if you have been in close contact within 6 feet of a person with a COVID-19 infection for at least 15 minutes but do not have symptoms, you do not necessarily need a test unless you're a vulnerable individual or your healthcare provider or state or local health officials recommend you take one. This is a stark contrast to the previous guidelines health departments have stood by. Awais Vade with Champaign-Urbana Public Health Districts believes this is the wrong message to give people during such a critical time.
This is something that we do not agree at all. This is taking us a step back. This is not March of 2020. We are 6 months into this pandemic, and we have the resources to test a lot of people in this community. And why would we not?
Vade says there's a reason they continue to recommend people get tested.
A lot of individuals that we are seeing, cases, are asymptomatic. Unless you test, how are you going to find out if you're positive or not? And while you're asymptomatic or pre-symptomatic before you become positive, you are spreading this to many other people.
As it has been in the past, people are put in a 14-day quarantine if they've been in close contact with someone who tested positive for coronavirus. Doug Toole with Vermilion County Health Department says regardless if those people get tested, the quarantine should keep the virus from spreading in those cases.
The incubation period can take a while. And we find that folks tend to rush out. It's like, oh my gosh, I was around someone who tested positive. I got to get tested today. Well, it can take 7 days or so before it's going to show up.
The U.S. Department of Health and Human Services maintains that, above all, people should consult with local health departments and doctors to decide if they need to be tested. In the newsroom, I'm Jennifer Jensen, WCIA3, your local news leader.
All right, Jennifer, thank you.